Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? I promised y'all to bring you surgeons from across the country, and today I have a very special guest, Dr. Ryan Rebowe from, I'm going to say it how I pronounce it, and then you can say it how you pronounce it.
Okay, sounds good.
So from Mobile, I heard,
that's right, Mobile,
Alabama.
Mobile, Alabama. And I'm actually here in our Fairhope location today as well. So we do have a Fairhope location.
Awesome. So I wanted to bring surgeons from across the country to talk about the procedures that we're doing every day in their operating rooms. And today we're going to be talking about mommy makeovers with Dr. Rebowe. He's going to give us all the juice on how to find the right plastic surgeon for you, asking the right questions, and figuring out if this is the right procedure for you to have to get you to your dream body. Thank you for being on the show, Dr. Rebowe.
Absolutely. Thanks so much for having me, Mavi. It's really an honor and a pleasure.
Well, it's an honor for me as well to have you on. I want to first get my girls a little behind the scenes about who you are, and by telling us about how you got into plastic surgery and how you decided to put your practice in Mobile.
Sure, absolutely. So I'm not originally from Mobile, actually. I did grow up in the South. I'm from Baton Rouge, Louisiana. And I actually, I went to college in Virginia, came back to Louisiana for medical school. And I honestly happened upon plastic surgery during my surgery rotation. And, it's one of those things I always kind of wish I had a better answer, but I just honestly felt like plastic surgery was the coolest thing. I just could not believe that, these surgeons were manipulating anatomy the way that they were to create these just incredible results. And I just felt like this was the absolute coolest thing that I could possibly do. And now I'm, into practice, and I can tell you that I still feel that way, that I still feel like this is the coolest job in the world. So it's really been a huge blessing to be able to do this for people.
I love that. Plastic surgery is one of those paths that I think you land upon it and you fall more in love with it as you go.
Absolutely, 100%. It's just, when you see what we're able to do and then how it affects people's lives, I just truly feel like there's no better field.
Absolutely. So as I was scrolling through your Instagram, something that really caught my eye was your breast reductions. And on the show, we always talk about mommy makeovers with breast augmentation, but what we haven't talked about is mommy makeovers, which means multiple procedures at once for my girls who are listening. And so a tummy tuck with breast reduction. And breast reduction is one of those procedures that I feel is the most life-changing out there, breast reductions,
absolutely.
Tummy tucks. So why don't you tell us a little bit about your breast reduction experience and how it helps you mold women's postpartum bodies?
Absolutely. So it's an excellent question, and one that I really think, like you said, it's a combination of procedures that people don't often think about together, breast reduction and a tummy tuck, but they have so many similarities and really in their ability to just kind of change the way you perceive life. And what I mean by that is that, so for example, with a tummy tuck, it's not just about getting rid of a little excess skin, right? It's about repairing that muscle, fitting better in clothes, functioning better, feeling better. And that's really what a breast reduction is about. So for those people who really aren't familiar, we're talking about not just reducing the size of the breast, but also giving you a breast lift at the same time. And that's probably the most common question that I get about breast reductions is, do I get a lift at the same time? And they're really sort of on a continuum of the same procedures. Every reduction is a lift, while not every lift is a reduction, and we can certainly talk about that a little more later. But my experience with breast reductions, and people sometimes laugh when I say this, but it's really a life-changing operation. When you think about women who have excessively large breasts, and this is very common, especially after pregnancy, because of the way your body responds to estrogen, it limits not just the clothes that you wear, right? You can't wear certain clothes. I have a lot of women who tell me that it makes me look bigger than I am because my breasts stick out so far. It limits how I can exercise. It limits how much weight I can lose after I have a baby. It limits just everything that I do. You have a lot of complaints of back pain, neck pain. You can actually see shoulder grooving from bra straps in women with very large breasts. And so when you do a breast reduction, you're actually typically removing about, truly at least a pound, sometimes as many as 2 or 3 pounds from each breast. And so when you think about what that can do for your just normal everyday activities, it's really astounding. And so you have a lot of women who really have a big life change after a reduction, just in terms of overall health and quality of life. And it's really an amazing procedure.
I love breast reductions. I think, like I was telling you before we started recording, when I was a patient coordinator, my breast reduction patients were the happiest, the most thankful, the most grateful, the ones that if there was maybe a little wound healing delay, they just didn't even, they're like, I'm so happy this will heal when it's ready.
That's exactly right. I mean, really, it's a unbelievably satisfying procedure, not just from the patient standpoint, but we just love to see the change in people. And again, we're talking about this off camera, but honestly, in PACU, in the recovery room, they wake up and they don't even care about the soreness, in the breast. I mean, they wake up feeling lighter, feeling better. And then that, of course, just continues over time because as you know, it's not just obviously about relieving symptoms, but it's a huge aesthetic improvement in the breast for the vast majority of women. I mean, breast reductions, to me, it's just a huge cosmetic change. And so they feel better, they look better. It's an unbelievable procedure. It's one of my favorites.
You know what? It's probably because I had large breasts and I had a breast reduction. When I would look at my breast, I would think like, man, why my nipples are pointing down? Like, I wish they would be pointing up and out, not like down at the floor.
Yeah.
And after the surgery, I saw them and I was like, oh my God, my nipples are up finally.
That is actually the number one reaction is that, women wake up and they go, oh my gosh, I have not seen my nipples point this way in like years, Yeah, exactly. So it's a very common reaction. Yeah. We call that, by the way, the 630 breast deformity, both point towards the floor. And that is, undoubtedly the most common thing that I see in women who need breast reductions. And we get that fixed up, no problem.
And you know what? I think a lot of women, when they're going into some sort of breast surgery, one of the concerns that they have is nipple sensitivity. So what are some of the things that you do during your operation to help keep the nipple sensitivity? And if they do lose it, or if they do have some, I'm not going to say lose it, but reduction of it, how do we combat that, losing the sensitivity?
So the hard part, I think, about nipple sensitivity after any type of breast procedure, but in particular, a breast reduction or any breast surgery in which you're using what we would call a WISE pattern skin excision, which is the medical term for the anchor style or inverted T, is that really what I tell my patients is that all bets are off in terms of nipple sensitivity. And what I mean by that is that it's actually not just about nipples that can be less sensitive or lose sensation. I have a lot of women tell me that your nipples are more sensitive after a reduction, which is a very, very interesting phenomenon. Really, the important thing to know is that in about 80 to 90% of women who have any type of change in nipple sensitivity, that will return to normal in about 3 to 6 months. Okay. Unfortunately, it can be permanent, more common, as you said, in losing sensation, at least partially. It's pretty uncommon to lose sensation totally. But some of the things that I do or just look out for during surgery is that when you move that nipple up, right? So remember, we talked about moving the nipple from that lower pole of the breast to more centrally located on the breast mound. There are various techniques, obviously, to do that. You can look up some what we call an inferior pedicle, where you move it, saving tissue in the bottom, a superior medial pedicle. But either way, I try to save some of that central tissue, a lot of the tissue that actually connects the nipple to the chest wall itself, because that is where a lot of the nerves that innervate the nipple are actually running. And so while you do have to release it in order to get it to move, you want to try to keep as many of those attachments as you can, which not only obviously preserves blood supply, but should help you preserve sensation as well.
One of the things I'm going to start doing for my girls on the show is asking average surgery times, because something that I hear during my phone calls and a question that I get all the time is, oh, they said that my surgery is gonna be 6 hours long for my tummy tuck and my breast lift. And is that too long? So I'm starting this is the first episode where I'm gonna start asking what your average surgery length is for specific procedures, so that our listeners can know, okay, 6 hours, I guess that's not that bad, because if you are doing multiple procedures. So on average, a breast reduction by itself, how long do you usually have them in the operating room? And if you're doing a breast reduction with a tummy tuck, how long does that usually have you in the operating room?
So it's interesting you say that. That is a really, really awesome question that I feel like not enough people ask. Now, we do actually try to address that just in my normal preoperative stuff that I go over with patients. I do try to address that because it can be really disconcerting, not just for you, but for your loved ones. When you haven't seen your family member in 8 hours and you're like, oh my gosh, I thought this was just a simple procedure. What's going wrong? When in reality, nothing's going wrong. These are procedures that just take a while. Your average breast reduction will take anywhere from about 2 to 3 hours. And it's the same thing for tummy tucks. An important thing to kind of think about, obviously, when we're doing these is that it's just a lot of cutting and sewing. There's a lot of incision. And so it's just going to take some time, obviously, to just do the basics of the procedure. But anything in plastic surgery, whether it's a breast reduction, breast lift, tummy tuck, rhinoplasty, facelift, any procedure that we do, we really kind of say it's a millimeters a mile type of procedure. We're doing a lot of very fine work. And so, for example, breast reduction, 2 to 3 hours, tummy tuck about 2 to 3 hours. That 6 hour mark's a pretty good mark for a mommy makeover. And if you want to think, well, what exactly are we doing in there? Why is it taking so long? I mean, there are times when I take like 20 or 30 minutes just to do a belly button, just because you want to make sure that that belly button looks as perfect as it possibly can. And so something that may seem relatively simple on the surface, it can actually get relatively complicated when you're actually in surgery trying to make everything look absolutely spectacular.
Absolutely. And I feel like knowing the average time that most surgeons take in procedures will alert somebody who's hearing from somebody, oh, it's only going to be, an hour. It's going to take me an hour to do this procedure.
Right.
Because speedy or fast doesn't always equal good.
Yes.
If they're speeding through it, maybe there's multiple people in the operating room, and that also, can raise a question for you as a patient. Is there somebody else working on me other than the surgeon that I'm agreeing to have working on me, which we know. Yeah.
I was going to tell you that's a really important point. I mean, one that I absolutely cannot stress enough. And that's one of the things I really love about your show is kind of keying into stuff like that for patient education, because you are absolutely 100% correct in the fact that, like, I have patients all the time who will come to me, for revision surgery that were done at what it sounds like to me is a high volume clinic, right? And they'll say something like, yeah, my surgeon did 5 BBLs that day. And I'm going like, it's tough for me to do 5 BBLs in a week. And, somehow they're apparently getting it done in a day. But you're right. It's because the surgeon that you expect to do your surgery is often not the one actually doing it. And so, I would say that you are 100% correct. You want to look at the average amount of time that these surgeries take. And, look, if there's a surgeon that's doing a breast reduction and a tummy tuck in 4 hours and they're very, very speedy, that's totally, I would say that's quick, but it's not totally abnormal, right? But like you said, if you're coming out in 3 hours, or you're really having an operative time that's much shorter than average, it's a big red flag.
Absolutely. And actually, you probably, where you're located, your office is located, I bet you see a lot of revision work.
We do see, unfortunately, a lot of revision work. There's a lot of what I would consider predatory advertising in plastic surgery. Advertising based on either cost, convenience, misrepresenting your credentials, things like that. It's just, again, absolutely astounding what some people will put out there to get patients to them. And so we do unfortunately see a fair amount of revision work, but me and my senior partner, Dr. Park. And some things are a relatively easy fix. I will say, though, that the majority of it can be very challenging, and it is something that can be a little bit difficult to fix. But we're always here to help patients kind of walk through that journey, and really being a part of the process and viewing it as a journey is a big part of what we do here at our clinic.
I love that. I call it unethical practices. I
Yes,
like to
absolutely.
educate my girls so that they don't end up in unethical practices where they might end up having a procedure that they then need to get fixed, which ends up costing revision work, and revision surgery is a lot more expensive than doing it right the first time.
Absolutely. Absolutely. It's a lot more expensive. It's a lot more difficult. Your outcomes are more unpredictable. And again, it's one of the things that I really like about your show and what you do is that, it's about asking the right questions when you go in for a consultation. And to be honest, a lot of it's about paying attention to your instincts about what should be normal or what should not be normal for surgery. I had one patient who, just as an example, we did a revisionary surgery on. Unfortunately, it was actually like an urgent surgery because she was having problems from where she came from. But this surgeon was there that morning. She just met her surgeon that morning. Red flag number one. And she's basically saying, well, like, can we do this and can we do that? Can we add this? Can we do that? Add that? And he just keeps saying yes, 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 yes. And all of a sudden she's up to like 7 or 8 procedures that I think most surgeons, including myself, would say this is really just not safe, to do all at the same time. And thankfully, she had the instinct at that point to say, look, let's just cut back on some of these things, and again, still unfortunately had problems. But my point is, her instinct was correct. I mean, if it sounds like it's too much surgery, if it sounds like it's something that maybe shouldn't be done or that you shouldn't do, then your instinct is probably right.
If it sounds too good to be true, it's probably not true.
That's exactly right. That's exactly right.
So that actually leads me into one of my next questions for you, which was, I see about your surgery center, and I know you take a lot of pride in your surgery center, and I want you to educate my listeners about what your surgery center is and how it's different from what they might see out there.
That is a really, really excellent question. And so it's really important to note, actually, just starting from scratch, there's obviously lots of different types of surgery centers and places to do surgery, right? So, the sort of one that people think about is obviously surgery in a hospital, right? A much bigger setting. Then there's surgery in what you would consider a multi-specialty outpatient surgery center, which is where the vast majority of plastic surgery procedures are done, in my experience. And then you have other surgery centers that are more like an office-based surgery center, which is what we run actually at the PR clinic. So really what makes our clinic and clinics like it unique is that we're able to focus specifically on plastic surgery, and most importantly, specifically on each individual patient, right? So when you're looking at an office-based surgery center, the only problem with that is that you have to make sure it's accredited and that they're following all the checks and balances, because pretty much anybody with a medical license can set up shop in your office and make it look professional, right? So, for example, we are certified by the AAAHC. Please don't ask me what that stands for off the top of my head, but the AAAHC and the Quad ASF are the two major ambulatory surgery center certifications in the country, right? You do not want to be having surgery of any kind, whether it's office-based, ambulatory surgery center, that is not certified by one of those two commissions. Now, importantly, if you're having surgery in the hospital, they may have a different certification called a joint commission, and so you may not see the AAAHC or Quad ASF's tag there. But really, enough about certifications. What makes a office-based surgery center unique, and in particular our office-based surgery centers, again, we are there for you. We're there on a patient-by-patient basis. And so everything from your intake to the type of anesthesia you might have, right, because that can actually vary from procedure to procedure and patient to patient, to how you're going to recover and how you're going to receive your post-op instructions. Who's giving your post-op instructions? Is it a nurse that may have just come from giving someone instructions on a total knee, right? A total knee replacement? Or is it a nurse that really knows plastic surgery, can tell you exactly what to expect, exactly what you need for recovery, that sort of thing. So there are several advantages to office-based surgery centers. And I really feel like it offers that personalized touch. And that, again, just comes back to safety. If you are operating in an accredited surgery center in which you only do specific procedures, focusing on one patient at a time, our safety record is off the charts. I mean, it's going to have better outcomes.
Absolutely. And I feel like for my listeners, my girls who are thinking about having surgery, when you are considering different options and you're shopping, because we know they shop,
right?
One of the things that you need to be thinking about is, are you comparing apples to apples, or are you comparing an orange to an apple?
Right.
Is the quote that you're receiving that you're leaning towards because it's cheaper? Is it an office-based surgery center or office-based procedure under local anesthesia, under, not in a facility where you're going to be put under general? And these are all things that you need to be considering when you're choosing your surgeon. When I have my clients one-on-one and we're doing our consultations, I always meet with them to go over the different quotes so that we can really compare, like, okay, this one is this amount and what's included in it. And what does it actually mean? What does, for example, lipo 360, like what is it actually, what body parts are actually being lipoed? And versus this one, what's included in this one? And I help them decipher which one is going to be the one to give them the results that they're looking for. And that's what I do with my one-on-one girls, but I can't do one-on-ones with everybody.
Right, exactly. Well, and that's where things like the podcast, your podcast, really play a very important role in patient education. I think really important stuff, several important things about what you just said. Number one is the shopping. And from my standpoint, I encourage people to talk to multiple physicians. I'm Dr. Park and I are both very confident in what we offer. We know that we offer an excellent experience, excellent care, excellent outcomes. I'm happy for you to talk to multiple surgeons and talk to you again if you want to come in for a second or third consultation. This is a really important decision, and I want to make sure that you're comfortable with us and our team and the whole 9 yards. The other thing that you were talking about that I think is a word that people don't put enough emphasis on is experience. And what I mean by that is, what is your experience going to be if you have surgery here? Meaning, there are some clinics in which you might not see your surgeon after surgery for 6 weeks, right? How available is your surgeon to you if you have a problem or a question, right? You may not even be having a problem. You may just have a question. How available is your surgeon going to be after surgery for you? What is your overall experience going to look like on the day of surgery? Who's going to check you in? Like you said, where are you having surgery? What type of anesthesia are you going to have? You want to make sure you get an idea of what your process is going to look like start to finish, because all of those things become very important. I just was on the phone with a friend of mine, a little bit different, but we also do a lot of breast cancer reconstruction in our practice. And she lives in another state, had a question about her surgeon and all these things. And that was one of the things that I told her. I said, look, this is a process. You need to feel comfortable enough with your surgeon moving forward that, along this journey, they're going to be there for you and work with you every step of the way, because that's really what it is. It is a journey, and you want to make sure that, you, for lack of a better term, you jive with your surgeon, that you really are, that you're confident that he or she is going to be there with you.
Absolutely. Well, you don't know this, but one of the reasons why I brought you on the show is because you offer boutique style care.
Oh,
And
awesome.
that to me is something really important when I want to highlight surgeons on the show who are offering boutique style care. Because to me, if I'm having surgery, that's what I would want. I would want somebody who's going to hold my hand from before the surgery, through the surgery, after the surgery, in 6 months, in a year, if I have questions, knowing that I could still reach out and still talk to my surgeon about whatever it is, something that feels firm or a scar that
Yeah,
I might want revised.
absolutely. And I think it's really, and we actually run into this a lot with patients, is that you want to have a relationship with your patients in which they feel comfortable bringing up concerns to you. Because there are a lot of patients who are afraid to say, this doesn't look right, or this does, I wish this looked a little bit better, right? And it's often usually about something very minor, right? Maybe a tiny little dog ear or scar that could look a little bit better, right? But they feel almost like they're insulting your work, right? And in reality, that's not it at all. We want you to be happy. We want you to have the best result possible. And so you want to have a surgeon with a personality that is willing to accept those things. And what you just said about, boutique style care, that has been a vision, especially my senior partner, Dr. Park, and I wish we're in our Fairhope location, but our flagship location over in Mobile, it really is a beautiful, wonderful facility. We have our own med spa there that has plenty of lasers for your before and after care. Ability to do hydrofacials. That's where we keep our new InMode Ignite machine for the newest Morpheus, the whole 9 yards. So, it was a vision of Dr. Park, my senior partner, that, thankfully he was able to bring to fruition with two of us. He was a little, I think, overwhelmed, but he's an excellent surgeon. He was very, very popular around here, and almost too busy. So it's been nice going through that journey with him and developing this boutique style care that we're able to offer now.
I love it. I also want to hear, what are you seeing with that Ignite?
Man, I will be, absolutely guilty of saying that this is probably one of my, if it's not my favorite device, it's probably top two right now. It's just really an awesome device. There are, and I've loved the BodyTite platform for a long time, but we actually never bought one until the Ignite came out. And some of the knocks I heard on it previously were that, it takes a long time, and that is a concern. As you said before, some of our surgeries take a little bit longer. So when you're thinking about adding a BodyTite to like a mommy makeover, it's like you're already kind of reaching that safe time under anesthesia. Do we really want to add something else? But this newest platform, the Ignite platform, has what they call FaceTite, BodyTite, AccuTite Turbo, which really the Turbo it is higher energy, obviously, but it's faster. It's way faster. So it still takes some time, right? But it's easier to combine procedures and really get patients the results that they want with less downtime, less surgical time. And the results are just phenomenal in terms of skin tightening, fat reduction. I'm just really loving our results and loving the intraoperative use of it, honestly.
I love that. I love to hear it. I always like to hear what the surgeons are thinking about the different machines, because patients, of course, we're hearing, oh, this new machine is the end all be all. It's going to be the
Yeah.
cure to cancer,
I read on
everything.
Facebook that this is going to be the best thing for me. And machines are really a great adjunct to surgery, but you're right, there's a million of them. And one of the things that I tell patients that step in my office, especially for, there's so many machines, different treatments for the face, especially. They ask me, well, the most common thing I get is, well, can I do this, or would this treatment help me? And what I try to refocus the patient on is, well, tell me what your concern is. It's not really about what this machine will do for you. It's what your concern is and how many different ways do we have to get there. Because my job isn't really to like sell you a procedure, right? Like I don't consider myself a salesman. My job is to guide you as what is the best use of your time, energy, and money, right? What is going to give you the results that you want with the least amount of downtime, cost, the whole 9 yards. Because that's how you have happy patients, and that's how you have good results.
That's how you get good referrals.
Exactly. Yeah, exactly. That's how you have good referrals is happy patients and excellent results. And you don't get that by selling machines, right? You get that by making sure that people's concerns are addressed.
Absolutely. So, one of the questions that I see very often Googled when people are looking for breast procedures or tummy tucks is two of them. The first one is breast lift versus implants. And if you're one of my listeners and you've typed this in Google, here you go.
So that's probably one of the things that I feel like is the most confusing in breast surgery for patients, and honestly, even for some surgeons. And I think it's important to think about the difference between the two. And there's really no best way to explain it, but I'll just tell you how I think about it. Okay. A breast lift procedure is the best way to reshape the breast into an overall more aesthetically pleasing shape. And that can include things like raising the nipple, kind of removing some extra skin of the lower pole. But the breast lift procedure is really to reshape the lower pole of the breast, right? It's to give you a nice, round, well-shaped breast. The augmentation procedure can make your breast more round, right? It likely will because the implants themselves are round, but its main goal is to give you volume, and in particular, to give you volume in the upper pole, right? So, for people who are looking at pictures and they see online, and this is a really common one I get, right? People will come, and I encourage my patients to bring in pictures, obviously what they like. It really helps me understand what their goals are. But they'll say, here's a picture of a breast lift, and you see how natural it looks. But, someone who has done plastic surgery for a while, like you could probably look at it and say, well, it is a breast lift, but they also had implants, right? Like natural breasts are not super full up at the top. So implants are really meant to give you a little bit more fullness at the top. A lift is meant to reposition the nipple and reshape the breast into a more aesthetically pleasing manner. And to make it even more confusing, obviously, there is some interplay between the two, and you can get a little bit of a lift of the nipple with just a well-shaped and well-placed implant. And you can get a little more upper pole fullness with a lift. But in general, you're talking about two kind of different goals. It's also important to know that really commonly you can do them together, right? You don't have to get just a lift or just an implant. You can do them together, and it's something that you should definitely be talking to your surgeon about.
Absolutely. And you brought up that really good point of you can do them together. That's a question that I often get where patients are going to see a surgeon and they're going to get a reduction or a breast lift with implants, but the surgeon wants to stage it. And that brings me to my next point, which is when you're looking for your surgeon and you're looking for maybe a certain look,
Sure.
or you're looking for certain procedures, it's important to hear multiple opinions, because to one surgeon, he might want to stage it because he doesn't like to do them together, or he's had bad experiences, or whatever his reasoning might be. But to another surgeon who is more experienced in doing them together, it might be a walk in the park. It might be an easy procedure to do together all the time. So that's one of the things that when you're looking for your surgeon and you're asking these questions, it's okay to hear multiple opinions and then choose whichever one you resonate with. If you're okay with having two procedures and having it staged, then you can go with that one. If you're like, nope, I want to do it all at the same
Right.
time, then you know which surgeon to go with.
And I think you brought up a really, really excellent point about not just about the augmentation mastopexy procedure, but one of the things that really Dr. Park and I pride ourselves on is that, like, I don't do anything this exact same 100% of the time. And so, like you were just saying, like some surgeons, like I just stage all my augmentation mastopexies because that's the best way to do it. I'm not saying that's the wrong answer, but I am saying that I prefer an approach in which I try to look at every patient as they are, right? And a stage procedure might be best for them. And the kind of classic one is that if you've had a lot of weight loss, not necessarily from surgery or Ozempic or anything, like let's just say you lost a lot of weight after you had a child. It may be better to stage if your nipples are very low or your breasts are very what we call ptotic or droopy. It may be best to stage. But in general, they're a very safe procedure to do together. Your risk of revision is slightly higher when you do them together, but if you do them separate, then your risk of revision is 100%, right? Because you're always having two surgeries. And it's also important to note for people who are thinking about, okay, if this is something that the surgeon always does staged, just because you stage a procedure doesn't mean that you may not have to have a third surgery, right? It doesn't mean that they still get it right 100% of the time. So both Dr. Park and I take the same approach to this, which is, there are reasons to do a breast lift. There are reasons to do a breast augmentation. There are reasons to do them together, but it's really going to depend on that patient and what their goals are and, what their specific anatomy is.
I love that. I love that approach. So my next most Googleable question is tummy tuck versus lipo.
Ooh, man, that's hitting the high points today. Okay. All right. So let's talk first about sort of the term lipo, right? So lipo can mean all different kinds of things in today's world because there's, standard liposuction in which you're just using a metal rod and your brute strength, right? And removing fat. There's different types of energy assisted liposuction. We're using Vaser, ultrasound. There's smart lipo. There's power assisted lipo, which is what we use. That really is more for us, frankly, for the patients than for the patients because it's easier on us. And then there's the body type platform that we've already talked about, right? Where you're applying that energy to the skin. We don't apply energy, for example, during the lipo, but we will apply it with the body type machine if we feel like it is appropriate. So there's lots of different kinds of lipo, but liposuction is not going to fix what makes the majority of patients round in the lower abdomen. And that is, as you talk about on your show all the time, that is muscle separation. That is rectus diastasis. And so, when your muscles separate like this, when your six-pack muscles separate, it actually makes you more round and rotund, right? And that can only be fixed by a tummy tuck because we're going to see those muscles, we're going to repair those muscles, and it is typically going to give you a little bit of a tighter look because we're actually removing that skin. While you can get improved contour from liposuction and some skin laxity will be fixed, that tight, flat look is only going to be achieved by a tummy tuck.
Absolutely. I love that answer. You brought up something that I will die on the hill of. Please do not have a tummy tuck with no muscle repair.
Yes, absolutely.
Please, if you listen to anything on this show, just don't do that.
Yeah, it always blows my mind. And look, what I tell some weight loss patients in particular, because a lot of weight loss patients have not had children yet, right? They're in your office because they've lost a lot of weight from either now these GLP-1s or gastric surgery. And my discussion with them is always, well, you haven't had kids yet. We may or may not repair your muscle. But I can tell you 99.999% of the time that muscle's getting repaired because it's really what makes the result. And even from weight, those muscles can separate for any reason, but weight loss is also another common one.
Absolutely. So before I let you go, Dr. Rebowe, I want to talk about something that you put on your questionnaire, which is that you're a proud girl dad.
A very proud girl dad. I got three girls. They are 9, 7, and almost 3.
Okay, so with being a girl dad, one of the questions that I have for you is how do you talk to your daughters about plastic surgery or about what you do?
That's
How
an excellent
how
question.
what's your approach when you do talk to them about what you do at work?
So, thankfully they're pretty young and they haven't asked a whole lot of questions yet. But, what I tell them is that I'm a doctor and I make people feel better, right? I mean, that's what we do. And I help people with problems that bother them. Now, interestingly, we still do some insurance cases. We do, like I was talking about before, breast reconstruction and other things. And, my daughter will hear me talk about cancer related things and other issues that we deal with, and she's kind of keyed in on that. My oldest daughter, my 9-year-old. But in general, what I would tell them is that plastic surgery, at its core, obviously it's dominated by a female patient population, and it is so much about female empowerment and being comfortable in your body and about being comfortable with yourself. And that's really the approach that I take, not just with them, but in my clinic as well, right? This is about really empowering people to be their best self, to really feel most comfortable about themselves and how they look, and to really go out and conquer the world. And I think that's just a really beautiful thing that we're able to do.
I love it. I love that. I love that female empowerment.
That's right. Yeah.
So before now, okay, fine. My real final question. I always ask my surgeons, are you team drains or no drains?
I am unfortunately team drains.
Not
Now,
unfortunately. Not unfortunately.
unfortunately, I know. Unfortunately, I'm team drains, and I will just totally admit to it. It's a mental hump that I just can't get over. We are both Dr. Park and I are pretty aggressive in our liposuction and just tummy tucks in general. And I will tell you that even though I'm unfortunately team drains, in 5 years of practice, I can think of 2 seromas. So it's just hard for me to beat that track record with drains, and I have friends all over the country. My good friend, Dr. Pyle at Amelia Aesthetics, he gets on me all the time about transitioning to no drains. And look, we do progressive tension sutures. I do actually a lot of progressive tension sutures. Do I think it would probably be okay if I stopped? Yeah, it probably would be. But one of the things that's hard to get a surgeon to do is when you're getting really good results is to change our practice, right? Now, I will also say that my drain stays in a very short amount of time. It's very rare that I keep a drain in longer than a week. But you will have a drain at least for a short amount of time if you have a tummy tuck with me. But no drains for breast reductions, no drains for breast lift. Tummy tuck is pretty much my only drain procedure. So.
I always ask this on the show because for me, I'm team drains all the way.
Oh, good. Okay.
If there's a chance of fluid collection, please put a drain in. I know it'll only be in there temporary, and then
Right.
it'll be done, and it'll be forgotten. Because when I was a coordinator, and I've been a coordinator for multiple surgeons, just because they didn't use a drain didn't mean we didn't have seromas happening.
Right. Okay. That's. I mean, that's so refreshing to hear because, yeah, I preach this all the time. I mean, look, no one hates drains more than surgeons, right? Because you can do this beautiful surgery, right? And then all anyone ever complains about is the drain.
Drain.
I mean, they're like the bane of our existence. I promise you, if I thought it was better for you, I would not use a drain, right? But like you were saying, just because someone's not using a drain, they don't really tell you what's happening on the back end all the time, right? And that's, of course, not true for every surgeon. Again, I mean, I know plenty of surgeons that have a very low seroma rate, not using drains. For me, I'm a drain guy. So it's really refreshing to hear you say that.
Whoever's keeping score, I know some of my girls are keeping score on the show of who is team drains and who's team no drains. We have had maybe 2 out of all of the surgeons that I've featured who have been team no drains.
Really? Okay,
most of them are putting drains in.
And I think the team no drain, they make some really good points. And I think, like I said, it's hard to argue with their results, but I kind of feel the same way you do, which is I'm not always sure what's happened on the back end when we're not leaving a drain. But again, as long as you're getting excellent results and your complication rates are low, can't fault you for what you're doing.
You can't. So
I
would say,
I would like to know the score of team drain, no drain. I think that would be a good one. And if you want to put Dr. Park on there, he's also team drain. Okay, so that could be 2 for team drain. Maybe improve our stats a little bit.
Yes, I love it. Well, team drains is actually like winning by a long shot.
Good. There's landslide. That's right.
Landslide. And I know I have a feeling that the reason why you said unfortunately team drains is because you get a lot of patients who are looking for drainless.
Yep, that's exactly right. So many people come in and, like literally first question on their list is like, please tell me you don't leave a drain. And, I just have to tell them, look, I truly feel like it's what's best for you. If I didn't, I wouldn't do it. But, my job as a surgeon is, of course, to get you the results that you want. But number one is to keep you safe and complication free. Right. So, yeah, you hit the nail on the head. I mean, that is one of the top questions we get asked about tummy tucks.
I think it's influenced by the Facebook groups. The Facebook groups have a lot to do with the questions that are being asked in those initial consultations. But what I just had a conversation with one of my girls the other day, telling her, just because you see it on the Facebook groups and just because you see maybe this patient, her surgeon told her to do this, and this patient, her surgeon told her to do this, you don't know what that surgeon did during the surgery. And
exactly.
He's requesting them to do whatever it is, wear a garment, don't wear a garment, or whatever it is.
Right.
That's specifically towards their case and whatever he did for her.
Exactly.
Don't take advice from somebody who's not your surgeon, who didn't open you up and see with their own eyes what was down there and what was in there.
Well, and that's what I tell people too, along that exact same vein, is that because we hear this all the time, in particular about breast implants. My cousin, my sister, even my twin sister, right, got X number of cc's and this profile and things like that. And what I tell people is, like your sister's breasts are not your breasts, your sister's body, your cousin's body, your mom's. It's not your body. And that's not to say that those pictures aren't helpful, because like you and I were talking about, like, looking at that picture, I can still look at your anatomy and we can work as a team to figure out how to get you those results, right? But it doesn't mean that we have to use that exact implant or that exact profile, or it doesn't even mean that we have to do a breast lift possibly, right? It's just all about your specific anatomy. And again, working together as a team to get a good plan.
I love it. You hit the nail on the head.
Good.
So if my girls want to come see you, Dr. Rebowe, how can they find you?
The best way is just through our website. So it'd be www.parkrebowe.com. Our Instagram handle is PR_plastic surgery, or at Dr. Ryan Rebowe, or at Dr. Christopher A. Park. And you can call us at 251-340-6600. We do, obviously, the majority in-person consultations, but virtual consultations are also very popular.
Okay, perfect. So now if my girls want to see you, you know where to find him. And you guys also, if you send him a message on Instagram, he will be the one answering it.
That's right. I'll say I do for my personal, not for the practice Instagram page, but for my personal, if you send me a message, I promise I'll get back to you. Now, please give me a little leeway. It may not be that day or the next day, but I promise you I will get back to you.
I love it. So with that, you guys, I'll see y'all next week.
Absolutely. And I'll continue to listen, Mavi. Thank you for having me on.
Thank you for being on the show, Dr. Rebowe.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you. Not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.